This podcast is brought to you by India Knowledge at Wharton. Please visit knowledge.wharton.upenn.edu/India for more information.
India Imagine was the theme of the 2008 Wharton India Economic Forum that was held in Philadelphia recently. The day-long event attracted several leaders including APJ Abdul Kalam, former President of India, as well as CEOs of Indian companies, nonprofit groups, consulting, and private equity firms. India Knowledge at Wharton brings you one-on-one conversations with these leaders.
We're speaking with Rajiv Gulati, who is Director for China-India Strategy at Eli Lilly and Company today. Thanks very much for joining us.
It's a pleasure to be here.
Rajiv, what was behind Eli Lilly's joint venture with Ranbaxy in the 1990s? I understand that you joined Eli Lilly from Ranbaxy around that time. When the companies formed this joint venture. So what was the basis for that?
Okay, let me talk from Lilly's side because that was your question. For a long time, Lilly had been a Midwest-based conservative pharmaceutical company where US was the biggest market. So it used to be US and OUS business, which was much smaller. And I would say the culture of the company changed when the new chairman, Randy Tobias, joined from AT&T, and he was head of international business, and he believed that there is growth outside the US. And that was the time that Lilly started operating in China, Indonesia, India, Bangladesh, Sri Lanka, and many countries in Asia where it was never present. And when Lilly was starting in India, India had just started liberalizing. And the business environment was still tough. And it's a difficult market too, the distribution, for example. There are 271 cities with more than 100,000 population. Now, how do you reach them? To go in as a new company and set up distribution, all the regulatory approvals, the manufacturing needs which were there those times, it's not easy. That's where the partnership with Ranbaxy made sense. Ranbaxy was at that time the largest Indian company operating in India. And that's where the partnership came about, which really facilitated Lilly's entry into the Indian market.
Okay. Well, now companies like Ranbaxy and Dr. Reddy's are challenging drugs that are going off patent. So how is a company like Eli Lilly protecting itself from that trend?
See, these challenges have been there, will be there. So you protect yourself legally. So question is not so much how multinationals like Lilly protect themselves. I think there is a very strange question that Indian companies are struggling with. On one side, the patents have been reintroduced into India, and all large Indian companies want to become innovative pharmaceutical companies with their own patents. On the other side, they have this huge generic business, which is profitable, which is global. That's where they are, fighting lawsuits with the multinationals for the patents to go off so that they can sell their generics. Now, how do they make transition from a very large generic company to becoming innovative? So I think that's a challenge they are facing. Multinationals will have these challenges, it's a given, because patents have a limited life. When the patents are challenged, there is a 6 months exclusivity. That's where generics make most of the profit, because after that it's a commodity where the profit is much less. So that's a business model that all generic companies have worldwide. In fact, there is a company in the US, and 1 year I think it made more profit by out-of-court settlements than by selling generics. So that's a business model that was operating in the US for a long time, and now Indian companies are following the same one.
What would you say are sort of primary deterrents of innovation, or maybe the primary hurdles for innovation in the pharmaceutical industry in India, if there are?
Everybody talks about intellectual property protection. Intellectual property protection is a reward for innovation. If you don't have adequate protection, it does not reward innovation and it hampers innovation. And that's what, on behalf of Lilly and other companies, even as an Indian, I have been talking to the Indian government, that you cannot have research and investment in research within the country unless you have adequate safeguards to protect intellectual property.
Now, how does Eli Lilly's strategy for China differ from its strategy for India?
China is one of the fastest growing pharmaceutical markets in the world. It's already moved from the 12th largest to being 8th or 9th largest. In next 5 years, it will be the 5th largest. And by 2020 or 2025, this will be the second largest pharmaceutical market in the world, overtaking Japan, and just second to the US. So such a large and attractive market demands investment, a comprehensive presence. Please remember that in China, it's centralized. Even the courts report into the government. At one time, the pharmaceutical factories in China used to report to the FDA equivalent in China, which is a very strange situation. And therefore, when you are dealing with the government, you are working with them and they want comprehensive presence too. So all your regulatory approvals, your pricing situation, your intellectual property, they are all linked with one central power. So you work with that authority, and for sales, marketing, investment in manufacturing, investment in R&D, it's all linked and part of one large business process to have a comprehensive presence in a large market. Whereas in India, the local industry is extremely strong because of lack of patents for the last 35 years or more. And in that market, to compete even today at low prices and very high volumes is not a model which multinationals have perfected yet. Therefore, India has much more to offer because of their local industry strength and highly educated scientific pool of talent as a source for conducting clinical trials, for conducting discovery research, I would say for formulation development, chemical research, and so on. So I would say India is far more important, can add far more value by outsourcing research and other services to that country, whereas China adds much more value as a market, and that demands comprehensive presence. So you need to look at these two significantly differently.
Very separately. What significant trends do you see on the horizon for the pharmaceutical industry?
Pharmaceutical industry worldwide is a huge challenge. All of us know that. Large patents are expiring. And if you look at the quantum, we are talking of something like between $50 to $100 billion worth of patents expiring in 3 or 4 years. Remember, this is a $600 billion industry worldwide. So 1/6 of the global sales, or more importantly, 1/4 of the US sales for large pharmaceutical companies will vanish in next 3 to 4 years. That's one challenge. Second challenge is the rising cost of healthcare, which most developed countries cannot afford. In the US, we have 15 to 16% of GDP being spent on healthcare. In Europe, in Australia, in Canada, government pays for healthcare, and they are broke too. And all across the developed world, Japan, Europe, even the US, population is aging. Now, aging population means less productive people contributing to the pool and more people using the healthcare services, which insurance companies or the government has to pay for, which means that some kind of a control on costs, which will include pharmaceutical industry, either the pressure on prices, or in Europe, it's very difficult to get new products on the formulary where government reimburses. So you have government pressures, you have challenges of patents expiring, and the third thing is FDA, because of the recent happenings, has become very, very strict in approving new molecules. If you look at the trend, the new molecules approved by FDA every year has been falling. So you have patents going off. You cannot replace this with new products. And you have pressures on cost and formulary or the access worldwide. Now, this is a challenge all multinationals are facing, and it's a very, very difficult time for the industry.
As the global industry evolves, do you think that the differences between these markets are going to disappear?
Just give you a small number. In the US today, 70% prescriptions that are written are of generics. So by volume, that's already a very large market, and those models have been operating always. It's the 30% prescriptions of patented, which have most of the value because the price difference is huge, which is under a huge threat going forward.
Right. And do you think that it's still going to be an issue going forward, reaching population in India? You said you originally said that there was an issue with actually accessing that population, getting drugs out to them.
It is. In fact, most of the presentations that you are seeing today show that 60 to 70% of the population in India does not have access to medicines or the physicians. So that's a huge challenge. India is the 13th largest pharmaceutical market by value and 4th largest by volume. It has the lowest prices in the world and the latest medicines in the world available at those low prices. And yet, more than 60% of the population does not have access to medicines. And that's some things which got to change. I think government, industry, everybody needs to look at it completely differently if that has to change and access to medicine has to improve.
What kinds of moves are companies like Eli Lilly making towards changing that?
Eli Lilly, there's working on some specific therapeutic areas as far as that is concerned. And I would single out diabetes. Lilly was the first company in the world in 1923 to launch insulin, discovered by Dr. Banting and Dr. Best. And India and China, between them, have the highest number of diabetics in the world. And making low-price insulin available, that's one thing. But it's more about the awareness, the education, the diagnosis of diabetes. And you cannot treat diabetes only by insulin. Insulin is, in fact, a drug of the last resort. You start by diet, by exercise. Then you go on to the oral tablets and so on. And that's an area where Lilly is making significant efforts in both the countries, India and China, to raise the awareness level, the education level, and making sure that you are diagnosed early and you are able to take care of it so that you don't even need insulin or maybe you can delay using medicines for a while.
Right. Well, thanks very much for speaking with us today.
It's a pleasure to be here, as I said. Thank you.
For more information, please visit knowledge.wharton.upenn.edu/India.